Hi, my name is Justin Castillo, and to go over the questions prompted for the video titled, "What does a clinical exercise physiologist do?" To answer the first question, which clinical exercise physiology careers were new to me? The clinical exercise physiology careers that were relatively new to me were all the careers discussed in the webinar, except for cardiopulmonary rehab. All the other careers, like mentioned, that were, for example, bariatrics, exercise oncology, and clinical research, were all relatively new to me. I'm not too fairly educated on this field just quite yet, but it was great to know all the options that were out there. Answer the second question, which careers did you find to be most interested based on the population that they serve? The career that I found to be most interesting in clinical exercise physiology is in cardiopulmonary rehab. From the time that I took EKG interpretation and testing and stress testing back during my undergrad, it has always sparked interest in many aspects, I can say, whether that would be from enjoying the material that was being taught or knowing the importance of the topics being taught as well. Since that time, I have been intrigued to learn even more about this specific career, and hopefully make it a career choice of mine. And to bounce off that question, what skill set would be most valuable for me to learn in this case here? Based off this, I think having a wide range of skills would benefit me ultimately in the end of the day if I decide to go into cardiopulmonary rehab. Skills such as behavior management, being able to critically think, as well as being able to think fast in stressful situations. Having good/clear judgment, I think, is always great to have. And I think just being open-minded overall, just overall being very patient-oriented, know your patient, knowing how to help your patient, and lastly, just being able to connect with your patients. I think that would be some valuable skills, assets to have as a cardiopulmonary rehab in clinical exercise physiology. And lastly, what would licensure do for clinical exercise physiologists? I think being able to achieve licensure would change so many things for them, and I should probably say it would benefit them very much. First and foremost, I think from an aspect of either you can say respect or trust, you can say. There's many terms for it, but I would just say respect or trust. I think having that licensure would bring more trust and respect to all professionals in this career, and whether that's from a perspective of professionals working amongst clinical exercise physiologists or the patients themselves as a society. It will also allow for the ability to be able to open their own proper clinics as well, with the ability of being able to bill insurances. And just primary focus being on clinical exercise physiology, I think it would have just opened so many doors for clinicians and being able to just better care for their patients overall.